Pharmacokinetics. What is pharmacokinetics actually? In books definition that what the body does to the drug. Mainly, what is the word pharmacology? Pharmacokinetics mean, kinetics mean movements. Three parameters are important in pharmacokinetics. What are they? How the drugs move, right? How the drugs move into the body. First parameter, into the body. Second, through the body. And third, out from body. Three parameters are important in pharmacokinetics. Actually, this is the movements of drugs through, in and out from body, right? The simple definition is what the body does to drug. Or we can say that the effect of body on drugs, right? And the concentration of drug at the site of action. For example, if a drug acts on muscle cell, the concentration of that drug in muscle cell relates the pharmacokinetics and pharmacodynamics. This is the same point between the pharmacokinetics and dynamics. For example, if we have a graph here, this is administration of drug, this is absorption and metabolism, and this is elimination or excretion of drug, right? First of all, administration may be, this is oral administration, intravenous administration, intramuscular administration, right? After administration, this drug will move to blood, and this is called the concentration of drug in blood, plasma, right? After entering the blood, this drug will move to body tissues. This is the site of action of drug, this tissue, and this is on the boundary line of pharmacodynamics and kinetics, right? This is the relative point between the pharmacokinetics and dynamics. Without pharmacodynamics, we cannot learn pharmacokinetics, and without pharmacodynamics, we are incomplete in pharmacokinetics, right? Next thing, in pharmacokinetics, we will cover 3 or 4 things mainly. First one is routes of drug administration, their advantages and disadvantages. Second, we will cover the routes or the absorption types, how the drug move from the site of administration to blood, like passive diffusion, facilitated diffusion, active transport, endocytosis, etc. The next thing is absorption. What is absorption? How the drug absorbs from GIT to liver, from liver how it travel to systemic circulation, and how it travel into all the body tissues, because specific drug have specific affinity for specific sites. Like for example, if we take clarithromycin or azithromycin, azithro and clarithromycin have the affinity for respiratory system. Ciprofloxacin have very greater affinity for urinary system. Augmentin, coimoxicillin have greater affinity for bones. But if, right, so we will learn after pharmacokinetics and dynamics that in which condition which drug is suitable and in which condition which drug is contraindicated. Saida, pharmacokinetics or pharmacodynamics, one are relative, matlab. So let's start pharmacokinetics. There are 4 parameters, 4 important parameters of pharmacokinetics, and you all already know what are they. Absorption of Absorption of drug. Second is distribution of drug. Third is metabolism. Metabolism is also known as, here in pharmacology, this metabolism is called biotransformation, and we will discuss first order kinetics, second order kinetics, and zero order kinetics and metabolism. This is your separate chapter, right? And last there is excretion. Anyone in your class who can differentiate between excretion and elimination? What is the difference between excretion, secretion and elimination?
Elimination forcefully.
Forcefully?
Not the system.
Excretion जिसका extract मतलब glass और एक हमें बात बोल पता है elimination इसका मतलब जिसका
For example, this is a cell, right? This is a cell, and some hormones or some other chemical substances are producing by this cell, and this is called secretion. These hormones are secreted from, for example, adrenal gland secretes, thyroid gland secretes T3, T4, right? For example, I have muscle cell. This is muscle cell, and I take some glucose, and this cell break down this in energy, carbon dioxide, and this breakdown is called metabolism. Breakdown process is called biotransformation or metabolism. Excretion, when there is extra materials in body and they want to go out from body, this is called excretion. This breakdown of chemical substances and excretion, collectively these three processes is called elimination. This is a broad term, elimination. Elimination is metabolism and excretion, right? This is a concept. Secretion de toy, chio cell de da cell naga, elimination. Clear? Now the fourth parameter is excretion of drugs. Here we will talk only about drugs. This is the absorption of drugs, this is the distribution of drug, this is the metabolism of drug, and this is the excretion of drug. What is drug? Any chemical substance which can change our biological activities is called drug. What is medicine? When we have a calculated proper dosage form of drug, this is called medicine. Right? In pharmacology, any chemical substance which can be used for diagnosis, treatment and prevention of disease is called drug. Right? Pharmacokinetics, the first thing is administration of drug. Administration of drug. What is administration? Any way, by any process which is used to take in the drug to the body. This is called administration. It may be oral, may be parenteral, may be enteral, but for this we have routes of drugs administration. This is the first topic in pharmacokinetics, routes of drugs administration. Routes of drugs administration. You have a lot of MCQs from routes of drug administration, right? This is about bioavailability, about first pass metabolism, about half-life, about shelf life, efficacy, potency. All are dependent on routes of drug administration. It can be divided into three classes. Routes of drug administration can be divided into three classes. Routes of drug administration can be divided into three classes, right? The first one is enteral routes. Enteral routes of drugs administration. Any route which is related to gastrointestinal system is called enteral route. The second one is parenteral route. Any injectable thing is called parenterals, right? And except Enteral and parenteral roots. All other roots are classified in other roots. Other roots. There are three classes: enteral, parenteral, other roots. Enteral are classified in, first one is oral. Oral root, per oral. It is represented by PO, per oral. The second is buccal. What is buccal? When we place a thing, a chemical substance between teeth and lips, right? The third one is sublingual. The sublingual root is under tongue. When we place something under tongue, and this is very readily absorbed, like intravenous, it has no first pass metabolism, right? It's directly absorbed in blood from lingual vein, right? So this is sublingual route is when we place, specifically we place nitrates under tongue, and GSET tablets are placed under tongue, and it rapidly decreasing blood pressure, right? The next is rectal route. These roots are related to gastrointestinal system and are called enteral roots. First is oral root, buccal, sublingual root, and rectal root. The only acceptable route by patient is per oral, but some drugs are very sensitive to oral route, like gastric acids or enzymes present in mouth, right? So this is not suitable for all patients. If a patient is vomiting, so you cannot give drugs orally, right? The second is parenteral. All the injectables are called parenteral, right? The routes of administration for injections are, first, intramuscular, represented by IM, intramuscular. When you inject a medicine or drug into muscles, two muscles are very specific for this intramuscular injection. One is deltoid, the second is gluteus maximus, right? Intramuscular. The second is intravenous. Intravenous is emergency route. This is called emergency route because the only route which have 100% bioavailability, 100% blood is injected into blood, and it bypasses the first pass metabolism, intravenous route. So it is called emergency route. If a person is unconscious, we use intravenous routes. The third is subcutaneous. It is represented by SC, subcutaneous, right? When we inject a drug into adipose tissues, this is called subcutaneous route, adipose tissues. And the fourth is transdermal, intradermal. When we inject a drug into dermis layer of skin, this is called like insulin. Insulin is absorbed from dermis layer. Next is intrathecal route. Intrathecal. This injection is injected into spinal cord, cerebrospinal fluids, intrathecal route. Next is intracardiac. This is very rare, not used readily, but intracardial is also can be used. When a person have a last stages in myocardial infarction and we want to reduce his pain or her pain, we inject the drug into cardiac muscles, and this is called intracardiac route. Other routes, all the routes other than parenteral and enteral are called other routes. First is, for example, we have vaginal route, or for example contraceptives are used through vaginal. Antifungal drugs for fungal infections, we use vaginal roots. Second is topical roots. When we apply a medicine to skin, or we drops in ear or in eye, this is called topical, because it has no systemic effect, it has a local effect on some specific area, right? The next is, for example, or we can say administration in body cavities, administration in body cavities like eyes, ear, etc. And when we apply creams or ointments to directly to skin, this is called topical or other roots. Inhalatory roots, inhalatory, this is the root which is used by respiratory system, like for example ammonia. Spirit ammonia is also inhaled to a patient when a patient is unconscious. It is seen as stimulant, right? So these are the routes of drugs administration. We will use any one route from the following and will administer the drug into body, right? In any condition. These are the routes of drugs administration. Now for understanding pharmacokinetics, all the parameters of pharmacokinetics, we will take this oral route, right? For example, I am taking a tablet. Tablet is which type of dosage form? Solid dosage form. Capsule, suspension, suppository, semi-solid. This is for example 100 milligram of tablet, right? And we administer, this is called administration. This is the first step. Administration of drug, right? We administer this drug through mouth, so it is called oral route. You will represent it by PO, per oral, right? This is called administration of drugs. Here, which type of cells are present in stomach? Epithelial cells. Which type of epithelium? Columnar epithelium, cuboidal epithelium, right? Here we have blood supply. This is portal circulation, for example. The portal circulation is the only circulation which is taking the blood or the materials from GIT into liver, right? So this is for example portal vein or portal circulation, right? Now this is 100 mg of tablet. 100 mg tablet came into stomach. Here a process is called libration. This process is called libration. Through libration, this tablet will break down into additives and APIs. For example, we have medicine, not in drug. All the medicines are drug, but not all the drugs are medicines. In medicine, we have two things: API plus additives. What are the additives? These are the masking agents, coloring agents, flavoring agents, bulking agents, lubricating agents, right? Sweetening agents, right? 100 mg of tablet is break down into its additives and APIs. What is API? Active pharmaceutical ingredient. Is Green are, for example, these are active pharmaceutical ingredient, right? From here, this process is called liberation. Liberation is the process by which a drug break down into its API and additives particles, right? From here, now this is the area where the passive diffusion, active diffusion, endocytosis will work, because this is the absorption step. From here, this drug will absorb into blood. This is the drug which came into blood plasma. Now, this step is called absorption. What is absorption? How you can define absorption? This is the process by which the drugs travel from a site of administration into blood plasma. Right? This is the process by which, or the movements of drugs from site of administration into blood plasma, right? But here are very important factors which can affect this absorption. Like, for example, if a drug is having high molecular weight, or having high charges, or hydrophilic, water soluble, it will affect the absorption of drug. We will discuss this in detail in absorption chapter, right? But the factors which are responsible for affecting this absorption are pH, solubility, either the drug is water soluble or lipid soluble. Next is molecular weight, charge, ionization. These are the factors which can affect the absorption of drug, right? How this absorption take place, or how this movement occur? This occur on either on passive diffusion, passive transport, or active transport, right? So we can say that here are mechanisms of drugs movement, because we define pharmacokinetics as the movements of drugs, right? First is passive transport. What is passive transport? This is the movement of particles from high concentration into lower concentration without the use of energy, right? For example, this is the movement of drugs particle from high concentration to lower concentration without the use of energy, right? Passive transport have two types. One is simple diffusion, passive diffusion, and the second is facilitated diffusion, right? One is simple passive diffusion and second is facilitated diffusion. What is the difference between facilitated and simple diffusion? Let's see here. For example, we have cell membrane. This is cell membrane. We will discuss these processes in absorption, right? But here, if I have a drug concentration here, high drug concentration, and this drug have three properties. One is this drug is lipid soluble. Lipid soluble. Which drug will follow this passive diffusion? The drug which have lipids, which is lipid soluble, which have low molecular weight and having low charged or uncharged, right? These drugs will follow the simple diffusion. What is simple diffusion? Simple, the movements of the drugs from high concentration into lower concentration. This is called simple diffusion. What is facilitated diffusion? When this drug used some proteins channels, specific channels. This is called facilitated diffusion. For example, from here, if the drug is having low charge, low molecular weight, but the drug is water soluble, this drug will, for example, these drug have, this is water soluble, right? Low molecular weight and having low charge. These drug will follow facilitated diffusion because it used ion channels. This is facilitated diffusion, right? The next is active transport. What is active transport? If the drug is transported from lower concentration into higher concentration, right, with the use of ATP or energy. For example, if a drug have high concentration in liver, low concentration in liver, right, and for example here is the blood vessel and this is the cell membrane. This is cell membrane, right, and here we have proteins, right, and this drug is trying to go from the lower concentration into high concentration. It will use ATP, right? This is called active transport, right? The next is endocytosis, and endocytosis is when the whole cell membrane makes a vesicle around a drug and goes into the cell. For example, if we have a cell here, for example this is a cell and we have a very high molecular weight drug, it will come here and well enclosed in vesicle, but here we have some receptors. These receptors will bind to this drug, right, and at last this vesicle will separate it from the cell membrane and the drug goes into cell. This is called endocytosis. So which mechanism are followed by drug into cell or into blood? First is passive transport. Passive transport have two types. One is simple diffusion, second is facilitated diffusion. The second is active transport. Active transport use energy and transport the materials from lower concentration to high concentration. The third is endocytosis. When we have a very high molecular weight drug, it will separate it and are enclosed in a vesicle and goes into the cell. This is called endocytosis. Boreha lumbem sarada tikala da drugs movement share. बच्चा क्लास है उसका सर्जरी वाला सुट्टी तासो एक वर्ष सो कसानी है दुआ वर्ष दास रिकॉर्ड की वे वो पूरे सर्जरी वाला सिर्फ सही. So this is called absorption of drug, and these are the routes by which it follows absorption, right? After absorption, this drug will move into liver, right? Because this is portal circulation, and portal circulation is responsible for taking materials from GIT into liver. Here in liver we have now 100 mg. For example, for this is not 100 mg because here this is acidic environment, and for example 5% is removed or excreted. Now this drug is only 95% or 95 mg. For example, this 95 mg drug is transported into liver, the mother of the body, liver, right? It will check the drug first. This liver will check the drug that either this drug is toxic, this is beneficial, right? It will how it will affect our body, right? So from 95 mg, for example, it takes 20 milligram. This liver cell, for example, this is liver cell. This is liver cell, and this liver cell engulf 20 mg from this 95, right, and metabolize it. The remaining is 75 mg. This is the unchanged drug, right? This is the unchanged drug. This drug will metabolize, will affect, and will excrete it from body through biles. It will goes into biles. From bile it will leave the body through GIT, right? But here this 75 mg drug is unchanged, and it will go into vena cava, hepatic vein. It will goes into hepatic vein, and hepatic vein is drained into right atrium, right? So for example, the 75 mg of 75 mg drug is goes into heart. This is systemic circulation. Are you sure? Systemic. Pade mane poi the systemic circulation de. Yo hepatic go rasmung sarso kesma circulation de. One is pulmonary circulation, systemic circulation, coronary circulation, hepatic circulation, bronchial circulation, and portal circulation, right? This is portal circulation, this is systemic circulation. This 75 mg drug only reach into heart or systemic circulation. So this drug, which is an unchanged form and available for systemic circulation, is called bioavailable drug, right? So we can say that the first of all, you have to know about first pass metabolism. This thing is called first pass metabolism, the reduction of the drug amount by liver when it is first time passing from liver. So this metabolism is called first pass metabolism, right? What is first pass metabolism? It is also known as first pass effect, right? The reduction of friction of drug by liver when the drug is first time passing from liver. First, this is called first pass metabolism, and this unchained drug is called bioavailable drug. Bioavailable drug. So the fraction of drug which is in unchanged form available for systemic circulation is called bioavailability, right? Write it. Fraction of drug which is unchanged and available for systemic circulation after first pass metabolism is called bioavailability. And various drugs have various bioavailabilities. The drug which can be administered through IV route, intravenous, having 100% bioavailability. This is your top MCQ. Because IV route have 100% bioavailability, it is represented by F. Bioavailability representation is by F, and this is called emergency route. Except IV, all the routes have less than 100% bioavailabilities. Oral route have approximately 75% bioavailability, but it can be vary 50%, 60, 65, 75, 80, right? It depends upon the drug, right? This is bioavailability. Which factors can affect bioavailability? Absorption of drug, surface area of drug, blood flow to the site of actions. It can affect the bioavailability of drug. Next, now this drug is available for systemic circulation. Up to here it is called absorption of drugs, right? After reaching the systemic circulation, when the heart contracts, it will distribute the drug into all the body. For example, this is hepatic artery, which gives 100% oxygenated blood to liver. This liver will again get the drug, right? So this is the fraction of drug in liver. This is, for example, carotid arteries. This is carotid artery. By carotid artery, the brain will get drug, right? For example, this is renal artery. By renal artery, the kidney will get drug. For example, these are muscular arteries, all type cutaneous arteries, etc. By this, the muscle will get the drug. For example, ophthalmic arteries. By ophthalmic arteries, eye will get drug. For example, these are gastric arteries. Gastric arteries, and by gastric arteries, the gastrointestinal system will get the drug again, not in acidic environment but in their cells, right? By passive diffusion, active transport, either, right? This process is called distribution of drug, because the systemic circulation is now distributing the drug throughout the body. This is the distribution. See, this process is called distribution of drug. Distribution. Now, in distribution, we will discuss the volume of distribution, the clearance, and the factors affecting distribution of drugs, right? Distribution of drug. This is your separate chapter, distribution of drug. Having volume of distribution is very important, and distribution of drug. In absorption, we will discuss the factors affecting bioavailability, half-life, etc. In metabolism, we will discuss the first order kinetics, zero order kinetics, and second order kinetics, right? In distribution, we will discuss volume of distribution, right? So this is the distribution process by which the drug is distributed into different parts of body. From here, metabolism will take place. This is the exact metabolism. Liver is responsible for metabolism, but not 100%. More metabolism occurs in liver, but muscles also have metabolic activities. Brain also have metabolic activities. Kidney also have metabolic activities, right? But in this, we have a specific enzyme which is called CYP450, cytochrome P450, and this enzyme will be discussed in absorption very much, right? Because this enzyme is responsible for increasing the actions or efficacy of drugs. But here, metabolism will take place and it will form metabolites. In brain, metabolism will take place, but in brain, specific drugs can reach to brain, because the brain have a barrier which is called blood-brain barrier, right? Kidney will get the drug, right, and metabolite it. muscles, eyes, gastrointestinal system. This is called distribution of drug. From here, the drug will excrete in biles. This is gallbladder. In gallbladder, the biles will goes into duodenum with metabolites, and from duodenum the drug will excreted or leaves the body through feces, right? From here the drug can be go to liver, it can be go to kidney. If goes to liver, it will follow GI, and if goes to kidney, it will follow urine, right? The drugs metabolites present in kidney will excrete or will leave the body through urine, right? In muscles, it can be excreted in sweat, because if the drug is near to skin, right? It can be goes to kidneys, and it can be goes to GI, right? The next, from here the drug will excrete in tears, excrete in tears, right? If the drug reach here, it will excrete through rectum in feces, but it can be goes to mouth and will excrete in saliva. So these are the excretion of drug. This is the excretion of drug. The process, this is excretion. The process by which the drugs leaves the body is called excretion. In excretion chapter, we will focus on clearance, right? Because the dose management is very important in patients. For example, if you have a child patient, you have a up to 15 or 20 years patient, or you have 60 and 70 year patient, the dose management will be different, right? Because of volume of distribution, because of absorption, because of clearance, because of excretion. For example, if a patient having kidney problems, and you are giving a drug which follow the excretion route through kidney, you cannot give this drug into the patient which have kidney issues. These are the general principles or parameters of pharmacokinetics. After this, we will discuss absorption in detail, right? In absorption, we will cover the routes of administration. This is already covered, right? Routes of administration. But absorption, factors affecting absorption, bioavailability, half-life. These are our targets, right?